Welcome to The Pulse, the official podcast of the Georgia State Medical Association.
Hello. Welcome back. Thank you for joining us. My name is Dr. Julianne Adams Birt. I am the current president of the Georgia State Medical Association, and I am honored to serve during this podcast as your host. So far, we have heard from some great physicians. We are going to hear from another. He is the one and only Dr. David Williams. Let's welcome Dr. Williams, and I'm going to let you know a little bit about him. Thank you for coming. Thank you.
I'm very pleased to be here. It's an honor to be part of this. So I'm excited to speak a little bit about this particular topic.
Absolutely. We all need to learn a little bit more. So Dr. David Williams, he's the president and the chief executive officer at Southside Medical Center. And he has held that position since 1997 until now. He has specialty training in family practice and preventive medicine and a subspecialty training in age management medicine. Dr. Williams started his public health career as an epidemiologist with the state of Georgia and was the first director of the Georgia AIDS program. I am also very honored to work alongside Dr. Williams on the board of the Georgia State Medical Association, or GSMA, and he is also a board member and leader and is our president-elect. So thank you again for joining me. Thank you, Dr. Williams. We're going to get this conversation started. All right. So, Dr. Williams, I'm a gynecologist, so I deal mostly with women, of course. And I know that African-American women really kind of tip the scale, if you would, when it comes to the numbers of overweight and obesity in America. And here in Georgia, we actually have the largest population of African-American women, like in our state, the largest proportion of African-American women. And I hear it all the time, not just with my patients, but with friends, with family. Black women are just big boned. So I want to start this conversation off. Could you please explain to all of us what exactly is obesity? How do we define it? How was it defined? How do we define it? How should we define it? And what is the difference between being overweight and having obesity?
Wow. Okay. Where do we start? So you started off by being big boned, and some people call it pleasantly plump or whatever. But the facts are there really isn't such a thing as being big boned. Environmental, I would call it social pressures, find ways of making things sound more pleasant. Well, let me get right into the definition of obesity. In medicine, we use something called BMI, which means body mass index. And basically, it's a scale of measure which estimates how much fat you have based on your height and your weight. And so if you have a BMI over 25, between 25 and 30, you're defined as being overweight. Over 30, the definition is obese grade 1. Between 30 and 40, it's obese. After you pass 40, it's obese grade 2. Past 45, now you're getting into what we call as morbid obesity, and it's much more dangerous. It's important to understand that ideal body weight is essential for proper health. And even though it might look fairly appealing to be heavier or to have a big rump, or um, it doesn't necessarily result in good health. In fact, having too much weight can reduce your lifespan up to 18 years. So, the objective of medicine is to ensure that we live as long as we can and as healthy as we can. And so, obesity in this country, and by the way, obesity is not relegated to just people of color. America is the most obese country in the world. In fact, 3 out of 4 people are going to be overweight or obese in this country, of which there's 340 million people. So you can imagine that like 250 million people are going to be in that category. So being overweight or obese is a pandemic. In this country, 110 to 115 million, 110, 115,000 people die annually just from being consequences of being overweight. So it's a big, big problem.
Wow. I mean, so forgive me, but I'm just going to throw this in there, not to throw you off, but I did forget to let the audience know that you hail from Jamaica. And it made me think of what um, friends of mine have said. Man, when I go to Jamaica, they love me because of my size. So it just makes me think about how culturally we are so accepting, families and our neighborhoods, we're accepting. And how grandma sometimes when you came to visit, we said, "Oh, girl, you're so skinny. You need to put some fat on that,
Mhm.
on the bones, right? Some meat on them bones." Can you just briefly speak to not necessarily Jamaica? I'm not, getting on Jamaica. I'm just saying that idea that you don't look healthy if you are too too skinny.
Well, it's a reality. Being a little on the heavy side does not look unappealing. I mean, I'm not. That's not the point. You do. A lot of women look very well. Not just women, and men are sometimes being a little heavier is also more appealing, related to having looks like they're stronger, etc.
Mhm.
And so it is cultural, and it's also determined by influencers. You have many people who, because of they're in a position of influence, they basically influence many others to adopt their standard of what they consider to be very attractive. In some countries, like some countries in Africa, the heavier you are, the more attractive you are. I was born in Jamaica. I grew up here actually in the US. I came when I was 4. And over the years, I have noticed that the acceptance of being heavier has increased
Mhm.
little by little. In fact, it should be noted that in the early 19th century, the only people who had money or wealth could afford to be overweight, and that was considered to be a sign of wealth because most people couldn't afford to eat as much as necessary to become obese.
Right.
So, with the onset of foods that are easily made, not necessarily healthy, the onset of fast foods, which many in our population, it's part of their normal diet, and they consider it to be eating healthy. Well, the resultant factor is obesity, as well as many factors such as the increase in use of artificial sweeteners, such as high fructose corn syrup. Um, and so there's a lot of things that have led to this pandemic of being overweight or obese, and social pressures, influence, but mostly important is diet, what we eat, how much we eat, and what types of food we eat.
So can you're starting down the path that I wanted to go. I would like to let me first say this. I am learning. I've been practicing
Mhm.
medicine for 20 years, and I am learning to change my language. So instead of the 30-year-old, female in room 2, the obese woman in room 2, we are starting to do a better job, I think, of recognizing obesity as one of many, many chronic medical conditions, right? So I am very careful now to say 30-year-old female in room 2 with obesity instead of labeling her the obese woman, right? Um, and with that, I think it's important for our audience to understand what are contributing factors, because I heard you mention a little bit about diet. And I think some of the shame that some folks feel when they do go into the healthcare system, it's that look, or they feel like every time they go, the doctor is going to address that one chronic condition, even if it or as it relates to whatever other ailment or whatever else brings them in that day, right? So could you just speak a little bit about what are the contributing factors to the development of
Well,
obesity?
first, you brought out a very important point. It's not someone being overweight or obese is not something to for especially a professional as a physician to look down on. I mean, look around. It's like 3 out of 4 is going to have the same problem. It's a pandemic, but it's not something to be ashamed of. And you're right. It's a person that happens to be overweight, obese, but many individuals are that way not because of their own fault. They grew up with that. I mean, I grew up with finish everything on your plate. And if you had a potluck, you had to try everything. And your mother in particular, would say, don't leave anything. I remember her saying, there's people starving in Africa, so
Oh
eat
my
your food.
gosh.
I never,
Yes.
I don't know how that would help the kids in Africa, but we ate. So you learn to eat more than you actually needed, and it was considered wasteful to leave stuff on your plate. So children grew up in this environment. In fact, we grew up in an environment where put the food on your plate and you made a pyramid so it wouldn't fall off. And you had to finish that plate even though you did not really need it. So you can't, it's a society thing, it's a cultural thing. And what we have to do as a society and as physicians is to start telling parents what's the proper amount, how to properly make sure their nutrition is appropriate. Because, when we talk about malnutrition, many people believe it's because you're not getting enough food. But if you're getting the wrong foods, you're also considered malnourished. So is reestablishing what is the right amount of food and what type of foods. And first of all, it's no shame. The shame, I think, from my perspective, is when you get to the point where the being overweight is starting to affect your health, especially in a person that's fairly young, and you do nothing about it. Now, that's
Mhm.
where it becomes, I think, a problem because even though you yourself, I would say, a young parent or whatever, may not care about losing weight, you have to remember you have a responsibility of bringing up your children who depend on you. And if you're sick, you can't take care of them. And so that's where I would say a shame comes in. But when you take action, I always credit people. That's a good thing. Recognizing that perhaps I have a problem now. Maybe you're older, you start reading, you recognize, wait a minute, this may look sexy, but it's not necessarily good for me. And then start to do habits. And I don't believe in anything drastic. Do the right thing so that you can start getting closer to where you should be.
Well, amen to that. So you brought up a point that I really want to kind of focus on, and that is I kind of heard about raising our children, but if we now are, out of our parents' home, we've been out of our parents' home for a couple of decades, and we now want to address, start how do we address it? I'm really going back in my mind thinking about third grade. I remember being in third grade and my teacher, I remember her name, Mrs. Root, teaching us how to read a nutrition label. I remember, we had to bring items in from home, and she taught us how to read a nutrition label. And the very first thing, and the one thing that has stuck with me, thanks to Mrs. Root, is understanding serving amount, serving size, and then how many servings are in that particular
Mhm.
item. And the number of adults that I meet who think that that whole, container is supposed to be, consumed in that one sitting, but they never bother to read the label and understand that is the whole, the whole bottle is really
Mhm.
3 servings or
Yes,
whatever it may be.
absolutely.
So the retraining is going to be a mighty task, but I think one that's necessary, right?
Absolutely. And it's your question was where do we start? And it starts by recognizing, I mean, as you heard me you mentioned one of my specialties is age management medicine, and I also have a weight management clinic as well. And one of the things is understanding where are you? Sometimes people are very much surprised when they come into my clinic and I share with them how much they weigh and where they should be. Some are shocked because they had no clue that they were that far overweight.
Mhm.
And when we share with them what the impact will be over time, many of them immediately start to take action. But something simple, like you said about serving size. First, I encourage everybody to start reading the labels, and it will say how many servings is in almost anything you buy. If you buy some nuts, it will say there's 10 servings per bag. It's not one serving per bag, like you mentioned. But I use a simple formula for people because it can become quite a lot of work if you're trying to figure out calories and everything else. A simple method that I tell my clients is that listen, take an average plate and whatever you decide you want to eat, let's say you're at a potluck or wherever, put the food on your plate and make sure, I want you to imagine that the food, each item of food, does not like the other item. That means when you don't like somebody, you don't want to be touched by them, right? So you put the food and make sure they do not touch. And whatever you can get on there without it touching, you can slide a fork in between. That's the right amount. And do not go back for seconds. A lot of people say, well, that's not a lot, but really it is. And here's the other thing, another scenario that I tell people is imagine that you have a car and you drive 10 miles every day to a particular, let's say, to work. And to get those 10 miles, it only takes you 1 gallon of gas. But every day, you're required put gas in that tank. You have to empty out whatever you have and put gas in that tank every day. Now, knowing it only needs 1 gallon, would you put 10 gallons in there? Not. And the same thing, what happens to the body when you only needed X amount of calories and you put more than you need, just like gas, you're not going to throw it away, you're going to save it. And
Mhm.
what does the body do? It saves it in the form of fat. And it puts it everywhere there's fat cells. So it's the same theory. You only eat what you need. And the best thing to do, my best advice would be find a physician who specializes in this, and most physicians can, and have them do a BMI, but go further. We have specialized machines that does BMI, percent body fat. We measure how much muscle you have in every part of your body, how much fat you have, how much visceral fat, how much water, and then you've got the right figures. And so with that now, that provider will say, Mrs. Jones, you weigh, let's say you're 5'4", you weigh 200, you're really supposed to weigh 135. There's usually a shock with that, or 130, right? And of this, you have 40 pounds in your abdominal area. You have 10 in one leg, 10 in the other. And so you have a lot of fat, including the visceral fat, which is the most dangerous kind. And we need to get all that down. And so, but first is realizing where are you and where should you be?
Mhm.
Now, if I may, I will say that a lot of people are afraid to lose that amount of weight because they're afraid to look emaciated.
Yeah.
And they're afraid they're going to look pretty bad, like they have cancer or something. And I totally understand that. But that only occurs if you're on the wrong type of diet, and if it's not done correctly. And so we can, if you desire, we can get into that. But first, it's important to understand everyone should find out where do they fall in that metric. What is my BMI? Everyone should know what it is. How far off am I? And go from there. And so if you do that, I can tell you that if everybody was within their right BMI, we would reduce um, weight related illnesses tremendously. And many, in fact, almost every illness or disease that's out there is complicated by being overweight or is a result of being
A
overweight.
result, right. And that's
So,
exactly that's the conversation I believe we need to have also. Like you said, let them see where they are, but what are the short-term and long-term consequences of the obesity? And as a gynecologist, my conversation, especially for my African American patients, is the fact that as women, that increases our risk. We already are at an increased risk
mhm,
of developing endometrial or uterine cancer.
mhm,
And, I try to explain, I do explain over and over throughout my day, you may be menopausal. You may, not be producing eggs. You're not ovulating. Your menses has stopped, at least 12 months. And so you now are labeled as menopausal. But where do we make more of our hormones, our estrogen, in our fat cells? And of course, most of my patients, when they're coming to me talking about hot flashes and night sweats, they add in, and I can't lose this belly, the menopausal belly, which is increasing the visceral
right.
fat mainly that you spoke of. So I
Mhm.
think it's the conversation is long, but I do think, and I wanted you to just touch a little bit more on those medical conditions of, a few things just to bring it home.
Related. Very good. First, it's important that there's been many studies to show, and this may shock people, there does not exist a state in which you can say a person is fat and healthy. The absence of disease does not make that someone mean that someone is healthy. Okay. It means so what they have shown is that you may not have anything that's obvious, but things are happening.
Mhm.
And over time, a lot of things will happen. So to consider that, well, I don't have anything right now, things are happening, but eventually the chances of you getting something are much higher if you're overweight. So the consequences, almost every disease that we can think of is related to being overweight. The most common, hypertension, high cholesterol, diabetes, which there's some studies. I was in a conference this week where they said that um, population, almost 3 out of 4 are in pre-diabetic state, just like those who are either overweight or obese. So diabetes, arthritis, sexual impotence, um, cancer, infertility. The list is very long. Almost
Joint,
everything managed is related to being overweight.
I was
So
adding in joint problems.
absolutely, absolutely. I mean, in my clinic, I have had many clients who, after losing simply 15 pounds, all their joint problems went away.
Yep.
Their joints were not designed to carry so much weight. And so there are so many benefits with losing weight. Not to mention, you'll save a lot of money as well because food is getting very expensive out there. But the simplest way to improve your health is simply losing weight. And many medicines that we're taking, we could probably come off of after you get to your right weight. So, unfortunately, we're giving medicines to try to help mitigate a disease that's caused by overeating. Stop the factor, which is overeating, and you know what? In many cases, you won't need the medicine.
Okay. So now I know where I stand. I know where I should, my goal weight should be. I understand that I want to live for my children. I understand that don't want to die prematurely. I think you said 18. Did you say
Up to 18
18?
years, depending on the level of obesity. Yeah.
Whew. So I understand that now. And so now I'm motivated, Dr. Williams. What are my options? And
Well,
what let me start here.
yeah.
What are my options if the I'm only 20 pounds overweight versus I'm 100 pounds overweight? Does that even look different?
Yes and no. Obviously, it's like a marathon. If you're running a marathon, which is 26 miles, you have a longer road to run than someone who's 25 miles or 26 pounds. So the length of time, and it requires a lot of willpower. I mean, eating is one of the greatest pleasures in life. Almost everything we do is surrounded about around eating.
Right.
And so how do it starts with a conscious decision that you want to be healthier, and it requires work. So, as far as is there a difference in the treatment? Well, diet is the mainstay in every weight loss program. Even though there's lots of medicines out there that people are buying by the droves that um, cause people to lose weight, just beware that they basically just curb your appetite, and because you're reducing the amount of food you eat, you lose weight. So it's still a diet. It's more like a forced diet versus you voluntarily deciding, I'm going to eat healthier and better. And of course, I am going to start to become more active and do a regular exercise program, which is very, very important. But the most important factor is your diet. A six pack occurs in the kitchen, not in the gym. And so you have to combine that. And I always urge you to see a professional, not one that's just prescribing you some pills because you become dependent on those pills. I just want to put that out there. The new medicines will allow you to lose weight, and some people really need that. But beware, you have to stay on those almost for the rest of your life because when you stop, there's a very, very high chance that you're going to come back with a rip-roaring weight gain, and in many instances be worse. So it's better if you can go into a diet plan that becomes a lifestyle change where you consciously are learning to eat healthier, exercising more, and going about it in a methodical and in a manner that you can control. I mean, nobody went to bed skinny and woke up fat. And so it's the same thing. It takes a little while, but if you persevere, whether it's 100 pounds or whether it's 20 pounds, you will reach that road. You will reach the end of that road and you'll be so much happier. You'll be so proud of yourself that you were able to do it, that you can conquer anything and you'll be much healthier. But start off by getting professional help with someone who's going to explain that to you exactly where you are and someone who's going to be measuring you along the way. We measure our patients every week. We do the BMI percent body fat every week. We're watching exactly what's happening. We know how much they lost in their arms and their legs and their abdomen, and we keep the patient informed so they can see their progress, and that keeps them excited because they see it happening. And I tell many clients, especially the women, I said, losing weight is going to allow you to go shopping, but shopping in your own closet because most of you probably have clothes in there that are beautiful that you can't fit anymore. And so you can go right back into your closet and get into those clothes you don't want to give away and you've been saving for when you lose weight. And and so I urge you to do that. Men don't care. They just, put on one suit and wear it forever.
Right. When in your patient population, the clients that you see, is there a is it a BMI or is it the patients just the patient's wishes, or what are the factors for you to consider recommending bariatric surgery, at what point? And I don't want to say versus medications, but when is it time for you to consider a consultation with a bariatric surgeon?
Oh, that's a very, very important and very good question. As a family physician, I put it this way: surgeons cut, physicians try to heal. So, but there are clients who bariatric surgery, and they've come out with a lot of new methods, may be of benefit. Um, First and foremost, almost all clients need to see a physician to get to a certain weight before the bariatric physician can do what they need to do. And after that, the best treatments are those that they're followed up by someone who's going to continue to follow them after the surgery, because usually there's a problem there. Within 3 to 5 years, they found that a large portion of those who've had bariatric surgery regained their weight anyway. So you have to be followed. And that goes to the point. So, who would I recommend for bariatric surgery? I would recommend those individuals who have failed appropriate medical treatment multiple times, who really just can't do it on their own, cannot do it with help, and they need something further. And bariatric surgery um, is a method that basically forces you to lose weight because you cannot eat as much as you used to. And by not being able to eat, you lose weight.
Mhm.
And so, and some individuals need just that. In fact, quite a few. Um, I will say this: um, liposuction, and many people say they're going to get a lipo. No, is not a method for losing weight. It is
That
an
was my next question. Oh my God, you are reading my mind. Please go.
so liposuction is an aesthetic procedure. It's designed to make you look better. However, it is not designed as a weight loss method, and people need to understand that. And what's important is that, for example, where you store weight, where you gain weight, is basically genetic. You have people that they get most of their weight in the upper portion of their bodies, most people in the midsection, and then some who have it at the lower end. And so, junk in the trunk, and so some are more socially attractive than other areas, but that's all genetically related. So when they do liposuction, pretty much most of the time it's in the abdominal area, and what they're doing is removing cells from that area. But in the liposuction procedure, they usually can't remove more than about 8 to 9 pounds. So, and if you're over 100 pounds overweight, you still have a long ways to go. And if you have not curtailed your eating and have not been on a diet program, you will regain those 8 or 9 pounds, not in the abdomen, but in other areas. And this is what frightens people. I have clients coming all the time who've had liposuction, and now they're gaining weight around their neck, on their arms, and areas that they never had it before, because it's like that story I told you about the gas. It's going to store it someplace.
Somewhere.
And
Yeah.
fat cells can blow up like a balloon. They have unlimited capacity to get big. So if all the cells you have around your neck, that's where it's going to store it. And so be careful on that. Now, liposuction I recommend for people who they've gotten down to their right weight and they have some areas that just can't seem to go away. They got a little pouch there, but everything else is okay. You're perfect for liposuction. And that's when I would recommend that, or other aesthetic procedures where someone who's been very, very overweight and they have a lot of overhang of skin.
Mhm.
Then there's lots of procedures that can remove that excess skin, and you look really good. The patients come out very well.
Absolutely. All right. This has been phenomenal. The information is great. I want us to, as we start to wind down, to really talk about the prevention. We mentioned about the children, the importance of teaching, starting very young. Dr. Stanford, you may be familiar with her, out of Boston, and is an obesity medicine specialist. And I heard her talk, and she said the youngest patient that she's had is 2 years old. 2 years old. And I think as parents and as community and as school cafeterias and as folks who are responsible for what our children see and what they eat, you mentioned how food is everywhere. It's a part of everything. Wedding, you're going to have food. Birthday party, you're going to have food. Celebrating someone's retirement, don't you dare not have food. We bring it around, but we do, bags of chips, processed foods, Coca-Colas and what you want, Dr. Pepper, Fanta. we start we start our own families off on the wrong foot, basically. What is the responsibility? And we know the responsibility of us. Well, hopefully we're hearing the responsibility of us as parents. But what about community? What about the churches? What about the schools? The teachers, when they're having a party, for the beginning of school, for the end of school, and they say, sign up for what you're going to bring, can you just speak to what we can do as a community?
Well, like you say, the problem is pandemic. It's the whole world basically, and you have media which advertises drinking Coke as something that's going to make you happier, and eating a hamburger that's this thick with everything on it that looks like it's about 10,000 calories. And so this is what we grew up with. But I think the responsibility begins with the parents. First, they need to understand where they are, and the children will follow their parents. For example, there's a study that shows overweight parents, overweight children, because, for example, many parents, when the child cries, they stick a bottle in their mouth or they give them something to eat to make the child stop crying. It's usually something sweet or more than the child needs. And that's where it starts. Parents are not going out and doing healthy things with their children, like going out and walking and showing their children the importance of exercise and teaching them from a young age how important it is to eat the right foods. But they have to know it as well. And so when you say to churches and society, the simple problem is they don't know themselves. And so they believe this is healthy. And this is part of life. I mean, you hear about a social event or a wedding and there's plenty of food. Well, I always tell people, listen, weddings, birthdays, they happen all the time, but there's only one of you. So when you go to an event, nobody's going to be mad at you if you don't eat. They'll be mad at you if you don't show up. That's the thing. You're there for you, not, it shouldn't be for the food. Now, eat a small amount, but they're not saying, oh, you better eat this plate full. No, you leave, that's just more for them. But some people have told me, well, I don't want them to be mad at me for not eating. I said, really, they're not mad at you. You showed up. You're there for them, not for the food. And so, yeah, I mean, I want to be realistic. When you go, eat in moderation, recognize, like you mentioned, Dr. Birt, that what is a portion size?
Mhm.
Use the simple formula that I suggest is put just enough on your plate so things don't touch and eat slowly. This is an important factor, and I want to emphasize this. Learning how to eat, time your eating. In layman's terms, when we eat, you might have noticed that if you eat very quickly, you can eat more.
Mhm.
And it takes about 20 to 25 minutes before the signals from your gut go to your brain and say, I'm full. So what happens, people eat twice as much as they need and they didn't recognize they were full. And then about 30 minutes later, they're saying, oh man,
Yeah.
I ate so bad. You said, why didn't they feel it early? It's because the signal did not reach. So take your time, eat, converse, and if you give yourself 20 minutes to 25 minutes, if you only ate half, you're going to feel satisfied and full as if you'd eaten a lot. The
Mhm.
benefit with that is you're not going to feel groggy. You're not going to want to sit down there and sleep. So if you practice eating slowly, smaller amounts, you're not going to feel hungry because it's like a car. If you're on empty, and you put a gallon of gas, you're no longer empty. Is that correct? The same with the body. You're hungry, but after you eat a portion, you're not starving. You have food. And so learn to you will gain more weight eating a large amount at one sitting than eating the same amount over a period of a day. So understanding those kind of things and looking at what you eat, this is so important. The quality of the foods that we eat. And this is the reason why I hate to say it, but our people of color, we die younger and earlier. And I would dare go as far as to say the number one reason is diet.
Mhm.
What we eat is killing us as Black people. We eat and we encourage our children to eat the wrong things. And then we, in our social environment, we believe I have clients, young women who have beautiful figures, but now the thing is to look like the Kardashians with the big, butt. And so they are forcing themselves to get bigger because they want to fit in.
Mhm.
And it's sad. I see this all the time. That they want to get bigger because they feel like I am not the I'm too small. And when you and they're perfectly fine. They look very healthy. They have beautiful figures. I mean, by the way, people of color are blessed with a beautiful figure, whether it's small or large. You don't need to. But we have this impression that bigger is better, and
Right.
it's not healthier. It's not better.
But Dr. Williams, you have energized me to get my pantry fixed a little bit here. I'm all about teaching and modeling for my
Mhm.
own children. I just want, as we close, I just want to throw out to the audience members just some practical tips, and I'm going to let you end it. But these are the kind of things that I share with my own. I loved how you said the 20 minutes. My boys will tell you we always are harping about wait 20 minutes. But mommy, I want wait a few minutes, and they count it down. They will look at the clock and count it down. But I also want to share some practical tips. Like you said, we did not get this weight overnight. It's going to take some time, and it's going to take consistency. I tell patients, you have to change what you drink, right? So water, like, drink more water. Let's start with that. If you work in a building and you work on the second or third floor, why is everyone congregating around the little button waiting for it to light up and the doors open? Take, consider taking the stairs. Um, I laugh in the parking lot. Folks just be driving around trying to get closest to the door. And I'm like, no, park further in the back and then walk those aisles. And I always tell my patients, I don't have a dog or a cat, but when I go grocery shopping, I walk up and down every aisle. And I rarely buy things. I rarely buy processed foods.
Mhm.
People probably have heard. If not, I'll say it. Shopping the perimeter of the store, you're going to have
Absolutely.
your healthier foods out there. But I walk the aisles because I'm getting my steps in. Just practical things that we can do even tomorrow. You don't have to wait. So you take it home and give us some
Well,
of
those are
your,
excellent suggestions, and
yeah.
they're so practical that anybody can do it. But you're absolutely right. I rarely take the elevator because it's healthier to walk up the stairs. And like you, I park away mainly so somebody doesn't ding my doors. But it also has its benefits. Um, Little things like that are so important. Taking time to eat, watching what you eat. And I'll bring this out. Many parents make the mistake that they're giving their children all these 100% fruit juices. Be aware, even though it may be 100% fruit, you're giving them pure sugar,
Mhm.
fructose sugar. If you want to give them something healthy, give them the real fruit. But when you
Yes.
give them something like orange juice, a whole glass, it's like you're giving them 7 or 8 oranges, and you're taking out the most important part, which is the fiber.
Mhm.
And so give them the real fruit, don't give them the juice of the fruit. And drinks are one of the number one culprits that cause people to get obese because they're drinking Cokes. I see people buy a gallon a day, and even these what they call healthy, for sports drinks. If you look at how many sugars are in those things, and finally, I want to bring out something that's very important. Many people, I see them all the time. They're taking the Splendas and other things, the sugar substitutes, and they believe they're being healthier. Be aware. Studies have shown that those sugar substitutes, although they have no calories, actually cause your body to gain more weight. And on top of that, they're very unhealthy. So if this is going to sound weird, but I try to eat nothing that's not pure. If you cannot pronounce it, you shouldn't eat it. So if it's labels and it has some chemical name, you probably shouldn't be eating it. And the first thing on the label on any package is what it has the most of.
Right.
So look at what you're eating. Avoid things that says high fructose corn syrup. Okay. And eat in moderation. Take your time. Walk. Avoid the juices. Avoid the sugarless things. If you're going to, you're better off drinking and I'll tell you this, a secret. If you have to have a Coke, there's nothing wrong with having a soda every now and then. It's when you have 4 or 5 in a row or all the day that's killing you. If you're going to drink a soda, drink one that's from Mexico. You know why? Because they use pure cane sugar. All the drinks in the U.S., almost all of the canned drinks by the big manufacturers, they're loaded with high fructose corn syrup, which some say has 10 times more predisposition to obesity than the same amount of calories in pure cane sugar. And so, yes, if I'm going to eat something sweet, I want it to be natural. Okay. And however, I'm not advocating going out there eating sugar, but every now and then, and that's life. You have to enjoy life, but enjoy it in moderation.
Right.
Cut down on your total calories, and slowly over a period of time, you can get back to where you want to be. And that way, it's not drastic. You're not giving up life. You're just controlling your life. You're controlling what's happening, and that's the key. Take control and make sure you teach your children the right things from an early age, and they won't grow up obese.
This has been excellent. Thank you so much, Dr. David Williams. And I am going to share one thing. A patient said this to me. She said, my grandmama said, if what you are about to put in your mouth, if it sits on the table and does not spoil in a few days, you may not want to put it in your mouth. I said,
Absolutely.
well, I'm going to take that one. Makes sense.
Does.
So thank you so much. We appreciate everyone joining us on the Pulse Conversation with Georgia's Black Physicians. We thank you for joining us, and you continue to stay tuned. Thank you.
It's been my pleasure.
The content shared on this podcast is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by our guest and host are their own and do not necessarily reflect the official positions of GSMA. At GSMA, we stand on over 130 years of medical excellence and advocacy, but we encourage you to always consult your physician or qualified health provider with any questions you may have regarding a medical condition. If you think you may have a medical emergency, call your doctor or 911 immediately. Until next time, stay informed, stay empowered, and stay well.